Davis, telephone please. Dr. Davis, telephone please. Dr. Blair, Dr. Blair, Dr. J. Hamilton, Dr. J. Hamilton.
Hi Bigova family, how are we doing? How are you handling COVID-19 lockdown in your area? For me, I've been on lockdown for 3 months now. Can you believe it? 3 months. Please use this time wisely, just the same way I'm using this time wisely. So what do we do in Big Global family? We impact and profits follow. So for today, we're going to talk a little bit about COVID-19, this unseen war that the whole world is actually fighting for now, which is COVID-19. So some questions are actually in for me, for your girl, Dr. Williams, to answer some medical, questions about COVID-19. So this is frequently asked question about COVID-19. First question: what are symptoms of coronavirus, COVID-19? So it's all over the news already. The symptoms of COVID-19, one of it is actually fever, and then cough, dry cough. Then we talk about change of taste. Your sense of taste has actually changed, sense of smell has changed, sore throat, painful throat, difficulty of breathing, muscle pain, like muscle ache, diarrhea, loose stool, and then there will be headache. Second question most frequently asked about COVID-19 is, what are some other symptoms coronavirus patients may experience? COVID-19 patient may actually have fatigue. What do I mean by fatigue? It's like getting tired easily. Someone that can actually walk and run and do many things before can't do much. The person is getting tired while walking few steps. How long does it take to develop symptoms after you have been exposed to COVID-19? So mostly it takes 2 to 14 days for you to actually experience or manifest the symptoms of COVID-19. 2 to 14 days. Is it possible to have other corona symptoms without the fever? Definitely it's possible. Some people may not even have fever. They may just have the dry cough. Some people may have the diarrhea. Some people may have muscle pain alone. Some people may actually have the shortness of breath. They may not have the fever and cough before the shortness of breath. So definitely there can be other coronavirus symptoms without the fever. What are the early symptoms of coronavirus? Fever can be one of the early symptoms. It depends from person to person. So any of the symptoms we have discussed can actually be the early symptoms. So the next question: can coronavirus symptoms come and go? Yes, it can come and go. The symptoms may relapse. It may not come. They feel the fever and the fever goes away and comes back again. So it's possible for the symptoms to go away and come back. Can you have COVID-19 without symptoms? Definitely yes. You can have COVID-19 without having any symptoms. That is what we doctors call asymptomatic patients. The patient may not come up with any symptoms. The patient will just be okay, and the patient will passing the COVID-19 to another person because he doesn't feel sick. And those are the patients we doctors want to watch out for, and that's what we try as much as possible to do the contact tracing for any patient that actually comes to us for COVID-19. Then we ask them, who have you been around, so that we can trace who has the COVID-19 and hasn't have the symptom yet, that is actually passing the COVID-19 to other people. Are COVID-19 symptoms different in children than adults? Not really. Not really. Children can actually have all the symptoms we talk about concerning COVID-19. They may have decrease in taste, sensation, smell sensation, shortness of breath. Children can have the same symptoms like older adults and young adults. Does ibuprofen make coronavirus symptoms worse? Does ibuprofen make coronavirus symptoms worse? What do we understand by ibuprofen? It's actually NSAID. It's a type of NSAID drugs. What do we mean by NSAID? It's non-steroid anti-inflammatory drug that is actually used in treatment of pain, of fever and inflammation. So this drug can be used for rheumatoid arthritis. So for now, what this organization hasn't correlate any worse of symptoms of COVID-19 patient to ibuprofen, which is an NSAID use. They haven't correlated it yet. Instead, what I understand is that ibuprofen will even help treat the patient's symptoms. For me, I think disadvantage to it than disadvantage. How do I know if it's COVID-19 or the flu? So how do we differentiate between COVID-19 and flu? Right now, we can't really differentiate COVID-19 and flu based on the symptoms, because most of the symptoms that COVID-19 actually manifests is the same with the flu. So the only way, the best way for you to differentiate COVID-19 and flu, the moment you have any of the symptoms we've read before, is for you to go for the test in the hospital or any testing center. Go and differentiate it. Maybe it's normal, just normal flu, or it's COVID-19 you are having. When should I contact my doctor about my symptoms? The best time for you to contact your doctor or any doctor is when you feel like you're having difficulty of breathing. You can have the fever. When you're having fever, if you can still handle it, you'll be fine. Most of the mild symptoms and the moderate symptoms of COVID-19 can be treated at home. You can stay at home, bed rest, take care of the symptoms, and you will be fine. When you increase your immune system, you may fight off the virus from your system. But when the symptoms, any of the symptoms we've mentioned before, is actually becoming severe, then that's the high time for you to run to your doctor. Call your doctor or call any number that your country health system is actually providing for you to call. So that is all we're going to discuss for today. Thank you so much for your time. Thank you for branching into Big Global Family. Thank you for watching. And the next video, let me give you a hint. The next video is going to be about the myths and the facts concerning COVID-19. What are the things that people are suggesting might be happening with COVID-19, and what are the facts that are actually happening with COVID-19? We're going to be discussing it in the next video. Please leave your comments. What are the facts you know, and what are the myths you may know? It may be a part of those ones we're going to discuss in this video. So please don't forget to subscribe. Click on the subscribe. Please like the page, click on subscribe, and when you click on subscribe, the bell beside the subscribe button, please click on it so that you'll be notified anytime we post any video. Thank you so much, Big Global Family. We love you, and please stay at home, stay safe, and God bless you.